When people think about healthcare in Texas, their minds usually jump to the big hospitals in Houston, Dallas, or Austin. But step outside of those cities, and the picture changes fast. In a lot of small towns, the clinic isn't just down the road. It could be 50, 60, or even 100 miles away. That goes from being a drive away to a decision point. Do you make the trip, or do you put it off and hope that the cough, the pain, or the blood pressure check can wait? This isn't a rare story. More than 3 million Texans live in rural communities, many in what's called a healthcare desert. It's not that people don't want care, it's that the care simply isn't there. And when fixed clinics are too expensive to build in every community, families are often left out of reach. The people in these counties are most likely to put off care until it's too late. That's why mobile clinics matter so much. Think of them as healthcare on wheels, rolling hubs that bring doctors, dentists, behavioral health, and screenings right into your neighborhood. They park outside of schools, churches, or even the grocery store, meeting people where they are. It's not just about convenience, it's about equity. A mobile unit pulling into a rural town can bridge a gap that has existed for decades. Suddenly, families don't have to decide between gas money, missing work, or leaving their kids at home just to see the doctor. We saw this firsthand when historic floods hit parts of Texas. Homes were destroyed and roads were washed out. People were stranded without power, food, or access to healthcare. That's when we worked with our partners to get a mobile unit to Frontera Health. Their team went straight into neighborhoods affected by the floods, checking in on families, refilling lost prescriptions, or treating things like mold exposure. The patients felt more comfortable being in their own homes, allowing them to open up about the stress and the disaster that had shaken their lives. That kind of trust doesn't happen in the hospital waiting room. It happens when care comes to you. And this isn't just about emergencies. Rural Texans face higher chronic illnesses like diabetes and heart disease. Yet, they have fewer options to manage them. And mental health resources are scarce at best. Mobile clinics can bridge those gaps, showing up week after week and not just in moments of crisis. Now here's the truth. Healthcare doesn't have to stay locked inside four walls. It can move, it can adapt, and it can meet people where they are. Mobile clinics prove that your health shouldn't depend on your zip code. They show up for people that have been overlooked for too long. And they make one thing crystal clear, that no matter where you live in Texas, your health matters. If you want to know how much a mobile clinic costs, check out the video I've linked up here. And if you have any questions, drop them in the comments below the like button. We're always happy to help.